Hello, my name is Charlotte. I was struggling with quite a bit before coming to pelvic rehab medicine. I had stage 4 endometriosis and adenomyosis, as well as interstitial cystitis, chronic pelvic pain, anxiety, depression, medical PTSD, hypermobility, and I did also have extrapelvic endo or thoracic endo through my right diaphragm. And I had symptoms for probably about 18 years before proper treatment. So I was about 8 when my symptoms started and got proper treatment around 26 years old. So, and that was when I found out the extent of my diagnosis as well. And my pain level before coming to pelvic rehab medicine, pelvic wise especially, was probably 6 to 8 out of 10. Especially on the harder days or during my period. Yeah. So life before coming to pelvic rehab medicine, I had a lot of symptoms that impacted my day-to-day, but some of the most serious or painful ones were right shoulder, neck, and kind of scapula pain, as well as right rib pain around the rib cage and that kind of the bra line, as well as constipation, bloating like endobelly, nausea, poor appetite. I had chronic pelvic pain, of course, and I did have pain with sex, as well as fatigue, really intense fatigue. And I had endometriomas as well, ovarian cysts. So a lot was impacting my day-to-day. It was like sleeping, eating, bowel and bladder habits, the way I was able to function at work, and show up with even like fertility. So it impacted everything, really. And as far as like the holistic impact on my well-being and kind of all that it did, it's hard to really put into words how much your life changes when you go through something like that. When you're so ill for so long and you don't have answers and you think you're crazy or it's all in your head, and testing just isn't showing anything that would explain everything. So I worked 5 days a week at a pretty high stress nursing job as a hospice and palliative care case manager. I absolutely loved it, but my health was horrible during that time, especially my mental health, and I didn't have any kind of support in place for that. So as I started to change and notice more of what was going on with my health and learn more as a nurse and figure out how to advocate, I came to have, I had several failed surgeries. So I had 2 failed laparoscopic surgeries locally, and one of them was an ovarian cystectomy because I had a huge endometrioma that needed to be removed, and it ended up bursting on the table. And they took pictures, they saw other spots that they thought were endo, but they didn't touch it. 2019, a few years later, I advocated for surgery and they did ablation. About 1 year after that, I found an excision specialist, and that's when I found out the extent of my endo, as well as the adeno, the diaphragm involvement, and all of that. And then I came into a role where I started working from home. I had to work part-time. So again, like I wasn't able to function at full capacity or like I wanted to. My career changed, my relationship changed. This was all during COVID as well. I had 2 of my excisions as well as a BAT out of state during COVID, which was, quite a scary time and, difficult to get surgery. It was a long wait. There were concerns around fertility, intimacy. Of course, I talked about my career. And, it impacted everything. And treatments that I tried before, like I said, I did excision surgery, laps, and I also tried craniosacral work and physical therapy and lots of other things. So I was referred to pelvic rehab medicine by networking and connecting with other endo warriors and advocates online, mostly through Instagram and groups on Facebook. And then I got the confirmation from my excision surgeon because he also recommended that as a next step. I did see some local providers, and it was pretty clear that this was out of their scope, and they really didn't do this on the routinely, or they didn't do it regularly. So that made me feel much more confident. And, pelvic rehab medicine's protocol is backed by evidence-based research. And that also, as a nurse, made me feel like that was the best step. So for prehab, before pelvic rehab medicine, I had excision, but in that time or before that time, I also was doing pelvic floor therapy, EMDR, and kind of traditional therapy or counseling. I was working with a naturopath or integrative medicine doctor, and we were working together on kind of gut health, mental health, hormone management and balance, and chronic illness management. And then, I also did like yoga and meditation, craniosacral, myofascial work, like Ayurvedic abdominal massage to help with adhesions or scar tissue buildup, as well as like womb work. And I also then made a lot of changes over like 5 to 8 years, really slow and steady, like with my diet, kind of completely overhauled that. I started to do like fully organic and, less processed foods that were maybe anti-inflammatory, dairy-free or gluten-free, as much as possible. And that made, a change that made a difference over time. I didn't really see that much improvement till after excision, and then those therapies started to work better. And I knew though that I could find more relief. I was confident that I would be able to get a little bit more pain relief pelvic wise. So that's when I decided I was ready for pelvic rehab med. And advice that I would have for somebody else in this phase is to stick it out. It's a long journey, and it can be really isolating and can bring up a lot of fears and worries, and it can test relationships, and it can be really distressing at times. So just know that you don't need to change things overnight. Your body's been through a lot, and it deserves time to rest, heal, and receive care. And, connect with somebody else, other endo warriors or advocates, or even loved ones. Bringing in that support is pretty crucial at that period. So that's what I'd recommend. So prehab, I did pelvic floor therapy, I did acupuncture, I did massage for abdominal adhesions and for the womb or uterus, acupuncture, yoga, meditation, stretching, myofascial work, craniosacral work, working with an integrative medical doctor and a naturopath to do things like manage gut health, manage mental health, manage chronic illness and symptoms. I had made a lot of changes around my diet and an anti-inflammatory diet, organic, gluten-free, dairy-free. Also what I put on my body and in my body product-wise and in the home. I've made a lot of changes with that as well. But they were over a long period of time, many years and slow, consistent changes. But I knew that I could find more relief. I was confident in that. So what advice I'd have for somebody is to just really stick it out. It's a long journey, and you can make progress over a long amount of time as well. And you may not feel like you're seeing that difference But yeah, your body has been through a lot, and you deserve to have the time to heal and to feel yourself and receive care. So I would also say connect with somebody, an endo warrior or a loved one, or an advocate, because it can be a really isolating journey. There's a lot of suffering involved at times, and it can be really difficult. So that crucial support, is really impactful. And I would also just think about gathering your own multidisciplinary team, one thing at a time, depending on what your insurance covers and depending on where you live and what's around you. There's lots of options that you can incorporate over time that may help.